Do you know how well you're emptying your bladder? Well, there is a special test that's called post-void residual, meaning we're measuring amount of fluid that left in your bladder after you just voided. This is a very important test that can tell us about the state of your bladder and pelvic floor. So let's talk about what it is, how it's measured, and why it's important. So for those of you who have ever been in urological or urogyn office, probably experienced the fact of voiding first, leaving urine sample, and you go back to your room, and there are two ways to measure post-void residual. One way is with the catheter, when you put the catheter back in your bladder and you see how much is drained out, or another way is with ultrasound, and that's what we're going to talk about. So the measurement of PVR, post-void residual, with ultrasound is very simple. The ultrasound measures the fluid in your bladder. It's very non-invasive, and it doesn't require you to get undressed fully. We just need a small area of your body exposed in projection of your bladder. So why it's important to measure PVR? We need to know how efficiently your bladder can be emptied. So it definitely tells us the strain of your bladder muscles, of the detrusor. It also can tell us if your PVR is very high, there might be an issue with your bladder muscles, that they're weak, atonic, not working, or if your pelvic floor muscles are too tight that you can't really relax and let the urine flow out. So we also measure post-void residual after certain procedures. For example, after getting a bladder Botox done, to make sure that the muscles are working properly. We can also measure post-void residual after doing a sling procedure or repair of prolapse. And also, post-void residual can be part of routine examination if you come to your doctor with some urinary concerns, for example, frequency and urgency. We want to make sure that that happens not because your bladder is not working. So we would measure the amount of urine left. For the purpose of demonstration, I'm just going to do it on myself. I'm going to use some gel. So I'm placing it right above my pubic bone. That's where usually bladder is located. And the machine actually helps you to determine which way you need to go. So sometimes you need to adjust the probe and point it a little bit towards the pubic bone or towards one side or another, because the machine measures and reads each fluid pocket. So usually the first organ behind the pubic bone is the bladder. So that's why we're trying to catch and cover the bladder to see how much fluid is left. So over here we see the screen of our scanner, and we see that we scanned the fluid in my bladder, and it's 464 cc's right now, because I really want to go right now to the bathroom. So you want to take at least 3 measurements and average it, because you can see there is some slight variation between how much fluid you're getting. So now I'm going to go and void, and we can check my post-void residual. Okay, let's see what it shows. 0, huh? Let's double check. 13 and 5. So I'm actually pretty good with emptying my bladder. Yay! So let's talk about interpretation. What's the number actually means? Well, first of all, sometimes we can get a value of like 0 or 10 cc's, which is normal. You're emptying your bladder fully. But most of the time, the bladder is never fully empty. And it's totally normal to have a value of 20 cc's, 30 cc's, 50 cc's left in your bladder. So don't panic if you hear those numbers. There is also variation of normal. For example, if you're someone who is nervous or uncomfortable voiding in public bathrooms, it can reflect in your post-void residual because you can't relax fully and empty your bladder fully. And your doctor will definitely take that in consideration. So let's talk about at what value we start getting concerned. So anything above 150 cc's will definitely require us rechecking the post-void residual on another day. If we're getting values of 300 and 400, it definitely makes you want to perform a urodynamic study to see what happening to your bladder, what happening to your pelvic floor. And to put it in a context, the full bladder holds around 350, 500 cc's. So if you void and you still have almost a full bladder left behind, I have a lot of questions that I would like to find answers to. It's also common practice that if we notice a high post-void residual, we likely will ask you to go and try again, and we will recheck that again. Because again, a lot of people have shy bladders and just need another try. In some cases, post-void residual used as kind of like another vital sign. So if I operate on you or plan to do a surgery, I would like to know how well you're emptying your bladder before surgery, so I can also measure it after surgery. And there are certain cases where post-void residual might be difficult to measure or might not be reliable. One of the situations is when you have a lot of fibroids in your uterus, because when you use the ultrasound machine might misinterpret those fibroids as a fluid, and it will show a very large post-void residual. Another case, if you have a very advanced prolapse, meaning like you can see and feel the bulge going beyond the vaginal opening. In that case, it's very difficult to measure that volume in your bladder through your stomach. And the third case, if you're pregnant, because when we're pregnant, we have a lot of fluid in the uterus and the machine will pick it up. So how can we measure your PVR in any of those cases? We can use a catheter that we place through the urethra and get the direct reading of the amount of fluid left in your bladder. Post-void residual is a very important value and test that's done in urological urogyne practice and can tell us a lot about your pelvic health. So next time you get to do it in the office, you know what it means.